Pharmacology, Cardiovascular and Renal System Introduction. The heart is the powerhouse of the body, providing oxygenated blood to organs so that they can conduct the vital processes needed to keep the body functioning. Without a properly functioning heart to ensure blood flow, cells are in jeopardy of oxygenation starvation, impairment, and subsequent death. Did you know that the average adult human heart contracts approximately 108,000 times in one day, more than 39 million times in 1 year, and nearly 3 billion times during a 75-year lifespan? Each heartbeat ejects approximately 70 mils of blood, resulting in 5.25 liters of fluid per minute, and approximately 14,000 liters per day. Over 1 year, that means over 2.6 million gallons of blood are sent through roughly 60,000 miles of vessels in the adult body. It is no wonder that the heart is the most important muscle of the body. This chapter will review. Here we review important concepts and disorders related to the heart and cardiovascular system before discussing common types of medications. So, review of basic concepts. To understand the effects of various cardiovascular medications, it is important to first understand the basic anatomy and physiology of the cardiovascular and renal system. So, location of the heart. The human heart is located within the thoracic cavity, medially between the lungs in the space known as the mediastinum. The great veins, the superior and inferior vena cava, and the great arteries, the aorta and pulmonary trunk, are attached at the superior surface of the heart, called the base. The base of the heart is located at the level of the third costal cartilage. The inferior tip of the heart, or the apex, lies just to the left of the sternum, between the junction of the fourth and fifth ribs. It is important to remember the position of the heart when placing a stethoscope on the chest of a patient and for listening for heart sounds. The heart consists of 4 chambers, 2 atria and 2 ventricles. The right atrium receives deoxygenated blood from the systemic circulation, and the left atrium receives oxygenated blood from the lungs. The atria contract to push blood into the lower chambers, the right ventricle and the left ventricle. The right ventricle contracts to push blood into the lungs, and the left ventricle is the primary pump that propels blood to the rest of the body. There are 2 distinct but linked circuits in the human circulation called the pulmonary and systemic circuits. The pulmonary circuit transports blood to and from the lungs, where it picks up oxygen and delivers carbon dioxide for exhalation. The systemic circuit transports oxygenated blood to virtually all of the tissues of the body and returns deoxygenated blood and carbon dioxide to the heart to be sent back to the pulmonary circulation. The chambers of the heart and blood circulation to the lungs and throughout the body. Blood also circulates through the coronary arteries with each beat of the heart. The left coronary artery distributes blood to the left side of the heart, and the right coronary distributes blood to the right atrium, portions of both ventricles, and the heart conduction system. When a patient has a myocardial infarction, a blood clot lodges in one of these coronary arteries that perfuse the heart tissue. If a significant area of muscle tissue dies from lack of perfusion, the heart is no longer able to pump. Conduction systems of the heart. Contractions of the heart are stimulated by the electrical conduction system. The components of the cardiac conduction system include the sinoatrial or SA node, the atrioventricular or AV node, and the left and right bundle branches, and the Purkinje fibers. Components of the cardiac conduction system. Normal cardiac rhythm is established by the sinoatrial or SA node. The SA node has the highest rate of depolarization and is known as the pacemaker of the heart. It initiates the sinus rhythm or normal electrical pattern followed by contraction of the heart. The SA node initiates the action potential, which sweeps across the atria through the AV node to the bundle branches and Purkinje fibers, and then spreads to the contractile fibers of the ventricle to stimulate the contraction of the ventricle. The cardiac conductive cells. Sodium, potassium, and calcium ions play critical roles in cardiac conducting cells in the conduction system of the heart. Unlike skeletal muscles and neurons, cardiac conductive cells do not have a stable resting potential. Conductive cells contain a series of sodium ion channels that allow influx of sodium ions that cause the membrane potential to rise slowly and eventually cause spontaneous depolarization. At this point, calcium ion channels open and calcium enters the cell, further depolarizing it. As the calcium ion channels then close, the potassium channels open, resulting in repolarization. When the membrane potential reaches approximately -60 millivolts, the potassium channels close and sodium channels open, and the pre-potential phase begins again. This phenomenon explains the autorhythmicity properties of cardiac muscle. Calcium ions play two critical roles in the physiology of cardiac muscle. In addition to depolarization, calcium ions also cause myosin to form cross bridges with the muscle cells that then provide the power stroke of contraction. Medications called calcium channel blockers thus affect both the conduction and contraction roles of calcium in the heart. The autorhythmicity inherent in cardiac cells keeps the heart beating at a regular pace. However, the heart is regulated by other neural and endocrine controls, and it is sensitive to other factors, including electrolytes. These factors are further discussed. The ECG. Surface electrodes placed on specific anatomical sites on the body can record the heart's electrical signals. This tracing of the electrical signal is called an ECG, or electrocardiogram, also abbreviated as EKG. Careful analysis of the ECG reveals a detailed picture of both normal and abnormal heart function and is an indispensable clinical diagnostic tool. A normal ECG tracing is each component, segment, and the interval is labeled and correspond to important electrical events. There are 5 prominent components of the ECG: the P wave, the Q, R, and S components, and the T wave. The small P wave represents the depolarization of the atria. The large QRS complex represents the depolarization of the ventricles, which requires a much stronger impulse because of the larger size of the ventricular cardiac muscle. The ventricles begin to contract as the QRS reaches the peak of the R wave. Lastly, the T wave represents the repolarization of the ventricle. Several cardiac disorders can cause abnormal ECG readings called dysrhythmias, also called arrhythmias, and there are several types of anti-dysrhythmic medications used to treat these disorders.